Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner. I feel like I need to say this because we had a comment last year that was saying I was not qualified to give any type of feedback on liposuction because I was a nutritional therapy practitioner. I am Dr. Martin's assistant as well. And this is Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon.
I think you're more than qualified.
I mean, how many lipo cases have I been in on? Hundreds, thousands?
I mean, thousands.
Yeah.
It has to be over 1,000.
Yeah, so the fact that someone thought I was not qualified to talk about
let's just talk about the commenters, which we love. But the woman that said I said woof when it was the wolf.
You did say woof. Mm-hmm. Dire woof.
They can be tough. These commenters can be pretty tough.
They are. They're listening. So it is 2026, Dr. Martin. Cue the fireworks.
Yes.
The confetti, the 2026-ness of it all.
Right.
I like even years. I've said that before, and it really backfired on me. So I'm going to leave all my comments about the type of year even years are to myself. Right.
And we established this is episode 205 for 2025, best of. So the numerology is lining up. There must be some meaning here for this episode, too.
Well, this is our top 5 moments of 2025. It's January 1st. We are going to be talking about our top 5 moments from the previous year's podcast. It's always my favorite episode of the year, mostly because we get Nils Mashup.
Right.
But up until then, we're going to hear our number 5s.
Right.
Before we get into all that, there's social media handles right here. If you would like to be featured on an episode of Beauty and the Surgeon, you can leave us a voicemail or send me a text at 303-630-9038 or leave a comment in the comment section below. Without further ado, Dr. Martin, should we jump right into it?
Sure. Are we Rochambeauing for who goes first?
No, Nils picked.
Yep.
What?
I want your job to be easier.
Yep. So I'm going first. Yep.
I was going to throw scissors anyways. That's what I always do.
The alphabet wins on this one. So this is my number 5. This is my longest clip of the year. I'm just going to say that. The rest of them get a lot shorter, but this one is my long one. So it's going to be the first one.
All right.
So here's my number 5.
Number 5.
Number 2 was a female urinal, which that one I think for lipo, I wouldn't recommend that one. Absorbable pads, adult overnight diapers, hydrogen peroxide spray.
The diapers may be for leaking from the liposuction.
That's what they meant for leaking. You will stain sheets and towels. It's unavoidable. No or minimal prep food, snacks, and a second set of compression garments. So definitely don't put hydrogen peroxide on your body. So they were talking specifically about using it to get stains out of sheets and stuff.
Okay.
Yeah. So like no hydrogen peroxide on a healing area. It's like the worst thing ever.
Is that still a thing? Because I had someone ask me recently, like, oh, shouldn't I put hydrogen peroxide on this? And I'm like, if you don't want it to heal, then you should because it's devastating.
Was that a thing when you guys were kids? Because it definitely was when I was a kid.
Well, it cleans a dirty wound, like a road rash.
Even the school nurse would like put hydrogen peroxide
on everything.
Yeah. Well, yeah, if it's dirt, if it's a dirty wound, yes.
No. Yeah, I get it.
There's a difference between cleaning dirt out of road rash with hydrogen peroxide versus putting it on a clean wound that you're trying to heal.
Which is not good.
No.
Gotcha.
It debrides.
Nils, do you remember the spray they used to do that was, I think
it was called Bactine.
Bactine, yes,
which is like
absolutely.
It burned like crazy.
Yeah,
it
be
burned.
like,
I like scream.
Or just straight up idea, where they take the big swab and get that
iodine,
big old thing of, glob of iodine. It's like, brownish yellow, and then put it on your wound. You just have that on your face at
Those
school.
are the good old days when there wasn't liability and they could do whatever they wanted to.
Totally. I think I'm old enough where they would actually give you aspirin at the nurse. I think that stopped when I got in middle school.
Yeah.
But I thought that was a great episode, but I really loved that we got to talk to Nils about Bactine because, man, that stuff burned. And I still remember we used that as kids and we knew how much it burned. Well, we had this little neighbor kid had come over and he, scraped his knee and we watched my dad spray it on this like road rashy wound, and this kid sat there like stone freaking cold.
Yeah, because he was a killer, man. That guy's a killer.
Seriously, I do think back on that. I'm like, I wonder what happened. His name was Eli.
Yeah, he's probably
and
like a Delta Force Navy SEAL guy.
Because we'd be like screaming like, no, Dad, like, it burns. And, and this kid just sat there and took it. And we were all like, there's something wrong with this kid.
Yeah, dude. Oh, he was feeling it.
He was hardcore.
Yeah, he was hardcore.
Yeah.
Spray some more.
I'm pretty sure you can kind of date yourself or show your age by explaining your school nurse experiences, right? So that brought back some nostalgia.
Oh yeah. Yeah, it was true because liability was less of an issue back then. So they would do some crazy stuff.
Yeah. Yeah. But overall, if you were having liposuction, I highly recommend listening to that episode. All those things were good. Yeah. Good things to have on hand. Minus the, don't put hydrogen peroxide on.
Yes. All right. This is my number 5. Which I don't want to have any preface to because I forget my order.
Okay. Well, then let's just hear Dr. Martin's number 5.
Let's go.
This next couple sentences come directly from plasticsurgery.org. The practice of medicine and surgery is not an exact science. With this particular surgery...
It's actually an art form. I say this all the time.
Yeah. With this particular surgery, the results are not always cosmetic because the breast tissue is thin as a result of having implants for an extended period of time. The results can also be affected if the implants have been leaking. In some situations, it may not be possible to achieve optimal results with a single surgical procedure, and another surgery may be necessary.
Yep.
Literally word for word what it says on plasticsurgery.org.
Yeah, that's really, really good.
It's so good. And this isn't meant to scare anybody. It's just to tell you, like, your doctor's going to do the best they can, but this is a surgery that can be very challenging if you've had big implants for a long time, you got bad capsules.
The concept of it is very easy in your mind. The doing part of it can be extremely hard. Some of the hardest cases I've ever done. I just did one of these in 2024 in the fall time. Terrible capsule, terrible asymmetry, bilateral ruptured implants, double bubble deformity with severe ptosis or droopiness of the breast. And I had to put implants back in. It almost would have been easier not to put implants back in.
That must have been a recon because that wasn't.
No, that was us. An obliterated pocket.
Oh, I know what you're talking about.
Yeah.
Yeah, that was actually more than, that was not in the fall of 24. That was like literally a year ago.
Oh, okay.
Yeah.
It felt like.
No.
It's like, it's one of those things.
That's been more.
Vividly, it's like Groundhog Day.
Yeah, no, that's been way
feel it in my
more than
bones.
a year ago. Yep.
The results, thank God, were great, but that was just me working on the fly, being super creative and using intuition. I mean, there was no cookbook. What are you going to go to? I mean, there's no cookbook on this.
She also had no idea what size implants she had.
It
was anybody's guess at that point.
So this is not uncommon. So, and I think this paragraph, surprisingly, is really good because it really just sums it up a little more formally, but really, a lot of these cases, you have to be flexible and creative and try to figure out novel ways to do stuff.
And from the patient side, you got to be patient.
Yeah.
Your recovery is not going to be, your results will not be instant.
Right.
Your recovery will be really easy.
Yeah.
But your results will be longer.
It takes some time.
Yeah. Dr. Martin, that's an amazing clip. That was also part of my top 5 clips of half of the year, midway through the year. I picked that exact same clip. It's such a good one.
Shows you that we're maturing in this podcast because I picked that out because number one, you brought on something from our society, which I thought was excellent in their guidance. We talked about my experience in a surgery. You reminded me that the case was actually 1.5 years ago, not 3 months ago, which shows you the world that I live in. But also that you were really giving great information to these people. So I think that's what we do, and that's what makes me so proud of being a part of this.
Well, that episode was actually a recommendation of someone who listens to my bodybuilding podcast, interestingly enough. So that's what was the impetus for that. That was a really good one. All right. You ready for my number 4?
Yeah, let's do it.
This is my number 4. So the first one is a text. So this is anonymous, but this was a text. Hi, doctor. Just finished watching one of your YouTube videos. I recently had facial plastic surgery. Woke up from the ankle down with no ability to move or feel my foot.
I didn't read this one.
It's been 2.5 weeks in bed with a boot on my foot, now feeling some shooting pains and pins and needles.
Yep.
Can't walk or move my toes, though. I can feel the scratch test with my fingernail, except for my ankle.
Yeah.
There is no feeling zone. Side note, I live in New York City, walking on concrete for years, and I was feeling strange pings in my toes pre-surgery. So I was definitely not in good nerve condition. I was under general anesthesia for only 1.5 hours. I have not had a nerve test done. Basically been told it's 6 to 8 weeks recovery. He did add a second text to me that he is a non-drinker and non-smoker, which I love that he thought we would ask that. Any tips or suggestions? Would love your thoughts. It's very scary, not to mention confusing. What did it? Compression, nerve blocks, pre-existing scar tissue that compressed the nerve, and which nerve? This was such a good question.
Such a good question. In general, like in most cases, probably the case here, especially since it was facial surgery, when you're asleep, your body is usually not, or when you're sedated, your body's not usually in an anatomic position. So it's really important for the staff, the nursing staff, the physician, to ensure that your legs and your arms are adequately placed and without impingement. And literally before every case, I go around and check everyone's legs and arms, not the staff, the patient. Show me your arms real quick. Are they working?
How are those legs?
Yeah, how are those legs doing? Can you kick a ball? So we'll check it and make sure. And what can happen is there's nerves, especially in the arms, run down on the inside of the arm, but there's nerves in the legs too. If you, do not have appropriate positioning, those can get impinged and then you get neuropraxia. If you already have pre-existing weakness beforehand, that can worsen. Now, I feel like this would be great just to give us like clinical questions and we try to figure it out.
Pearls,
it's like a sleuth. For him, he already had pre-existing issues. I think he said tingling in that leg beforehand. Is that correct?
Strange pings in my toes.
Yeah.
But in his toes. And his ankle is the part that's completely numb.
A lot of times, in most cases, when you see people and they have a kind of numbness in their feet or their hands, it's usually from the spine. It's usually centrally located. And so if you're just going to play the odds, this patient or this man probably has spinal issues. Sacral stenosis or narrowing down at the lower part of the spine that then has this presentation distally at the feet. After the surgery, maybe he had swelling edema, maybe he was positioned wrong, and whatever the process that was going on there worsened. What would you suggest in the situation without really knowing clinically what's going on with him?
I mean, giving it time. The other thing I would highly recommend would be acupuncture, because acupuncture can help with like regaining that nerve firing more quickly.
Yeah.
Even, I mean, if it persists, I would definitely start doing some occupational therapy, just to make sure that you weren't having weakening of the muscles when the nerves aren't firing correctly, just to keep it strong, like doing strengthening. Even things like contrast therapy, like any of those things that trigger those nerves, like with a different sensation, are going to help wake things back up.
Right. Hyperbaric oxygen is a great option, especially in this kind of situation. So if you think you were one way before you went in, one way when you went out, Occam's razor says it was related to the surgery, period.
In some way.
So it could be positioning related. He did question about scar tissue. Scar tissue can definitely compress nerves, but it's not going to be acute. It's not going to, you're going to go in one way and an hour and a half later you're different. Yeah, I can't believe we're talking about the feet, which is so funny. It's the one place I don't operate on.
Yeah.
I operate on everywhere but the foot.
Yeah. The good news is, though, I mean, the shooting pains and pins and needles, as uncomfortable as they are, is really good signs.
Yeah.
Yeah.
And one last thing I want to say. Again, you consult your surgeon, consult your physician. So we're just talking about this. There are so many reasons that people get shooting weird feelings in the extremities. I mean, we see it every week in our clinic. People have different medical conditions that can cause this. There's medications that can cause it. I just want to make a point that, there's so many different things that can lead to this. But if you go in one way and you come out another, to me, that's the surgery induced until otherwise proven, period.
Yeah.
That was really good.
Yeah. We get such great questions. And I love when people ask questions that, other people may not think about, but that could impact them and they don't even know it.
Right.
We talk about unanticipated outcomes, and that's definitely one of them.
Yeah. One thing it's so funny listening back. Now I'm like, I heard more things. He talked about his ankles being numb or his ankle being numb. So it's either the saphenous nerve,
which we've talked about before on our listener questions, when someone thought it was going to be removed, or no, the saphenous vein would be removed during a thigh lift.
So the saphenous nerve runs near the saphenous vein, which gets the inner part, the medial ankle, and then the sural nerve, S-U-R-A-L, gets the lateral ankle. The sural nerve runs like through the calf. The saphenous is more on the inside. So theoretically, a positioning could cause neuropraxia of either one of those. And if you had a spine problem, it's my understanding that it wouldn't just be the ankle, the dermatome. It could be, but it would probably be something more, So it could be a distal problem related to the surgery itself.
Yeah, or even just because of that popliteal fossa behind the knee, like even just something misplaced or slightly twisted, there, even close to the joint could be where that's coming from too.
Yeah.
So, yeah, that was a great one.
If this patient is listening, if he's listening, please write us back and tell us how you're doing so we can get an update.
Yeah, it would have been good to get an update. Yeah. All right, Dr. Martin, you ready for your number 4?
Yeah, so this one, per memory, is about brachioplasty. So let's look into it and see what's going on.
Yeah, and that can be extended in a couple of ways. I mean, there are rare times where we'll extend past the elbow.
Yep, I did that the other day. Yep.
Most commonly, though, we're extending it actually into the side or the torso. Right. Kind of down from the armpit along the rib cage,
right,
to kind of grab that excess, because a lot of people who do have excess skin of the arms also have excess skin of that kind of like armpit,
right?
Like towards the back.
Especially with weight loss in these GLP-1s, the change in the types of patients coming in with 70 to 80 pound weight loss, they almost always have laxity or looseness that goes through the armpit down onto the chest wall, and specifically what you consider where the bra line comes around. So you can extend the brachioplasty scar or incision through the armpit down onto the chest wall.
Yeah, but then you also have a mini or a short incision, or what we even call like a mini, like an axillary only, which is even more rare. So I think
we did the mini.
Yep.
Like a couple weeks ago.
Yep.
And I was pleasantly surprised. Normally those are kind of hard to make a big change, and she had a really nice change.
She had a really good change, and she, is a very, very slight patient, and a lot of our patients are, they've never been overweight in their life. So she was fine with the incision coming several inches down the inside of her arm, but not all the way to the elbow.
Not all the way. Yeah. She wanted it to be covered by a polo shirt.
Yeah, like a short sleeve shirt. And so we did that, and it looks great.
It looks good.
Yeah.
And we did Body Tight also. We can also talk about that later on. We combined it with Body Tight. So yeah, I think the minis, everyone wants a mini. Most people aren't a candidate for it.
Well, everybody thinks they want a mini.
Right.
Because that sounds better.
It does sound better. And then you can have combinations of all these. I've taken out just axillary or armpit tissue before. I've done a full going to an extended that was then connected with a breast reduction scar.
Yeah.
So we're talking about the types, but really it all kind of denotes the type of scar you're going to use. Just remember, though, that a full brachioplasty treats the arm from the armpit to the elbow, and a mini only does the upper third at the most.
Yeah. And an axillary does even less.
Yeah, an axillary would be the armpit
really
area.
just in the armpit.
Yeah.
Just gives you a scar for no reason.
Right.
I mean, it's kind of just a scar for a scar.
Yeah, I mean, yes.
It kind of is. It solves very little. But if you only have very little problem, it might solve it.
Yeah.
But in most cases, it won't.
Brachioplasty really exemplifies what we were just talking about, that the terms can be a little bit misleading. But I think the take home from that episode was one of the best episodes of last year. That's why I picked it, is that most people need a full brachioplasty.
You didn't pick it because I was so tan?
The other reason I picked it is because Amy looked like an Oompa Loompa color.
Dr. Martin sat down and he goes, "Oh, you look nice. Are you wearing makeup today?" I'm like, "No, man, I'm tan. I did a show like 4 days ago." Well, he didn't know I was competing. I mean, no one.
So how long does it take for that spray tan craziness to get off your skin?
I mean, you have seen me go through the process of having a spray tan at least 8 times now.
Yeah, but you're like a family member. I don't really look. So just tell me.
I mean, it depends on the tan, but like, for it to really go away, it takes about 3 to 4 weeks for it to like totally go away. But it's that first week, man, it's so nice.
That first week, I don't know, man, because you kind of look like you had cirrhosis.
I love it. No, I love it.
All right.
That first week is good, and then it gets real mangy.
You be you.
Yep. The bigger issue is not so much that the tan is getting weird, it's that the tan is getting weird and your hair is growing back because you've had to shave your whole body. So like and your skin's so dry because you've been like, exfoliating aggressively for like the 2 weeks leading up to the show, and then you get spray tanned, you haven't showered for like 3 days. It's just a process.
So why are we doing these shows?
Oh, there's nothing like it, because not everybody would. That's exactly why.
Okay.
All right. So we're going to get to our number 3s, and then I think we're going to take a break and come back for the 2s and 1s and the mashups. They're getting better and better.
And then I get to say, who does number 2 work for? That's every year. I feel it's like a Yule log.
It is.
It's a holiday special.
That's one of the Beauty and the Surgeon bingo card items.
Yes.
All right. So this is my number 3. This one was actually the one that started it all. What is something you wish you knew before having plastic surgery? And there were only a couple of responses. Expect better, not perfect. That as soon as one important item was fixed, I would notice other quote unquote huge flaws in myself that I had honestly never noticed before.
Right.
Happens all the time.
Breast reduction, you reduce the breast and all of a sudden your belly's huge.
Right. Like, when did I get this gigantic stomach?
Yeah.
Or, oh my gosh, my thighs.
Yeah.
Change most likely won't be that dramatic, and it occurs slowly. Which is true, I think, especially in things like a facelift, because you still look like yourself. So people think that nothing changed because in their mind, and they're looking at themselves every day. And then you show them their before pictures and they're like, oh my gosh.
Yeah, that's usually when the tears start.
Yes, because you forget right away, because you still do look like yourself. You look like yourself from 10 years ago, but to your mind, that's not different.
Mm-hmm.
So you start thinking that it's not different. I mean, you know how many times I've shown people their pictures and they're like, never show these to anyone, because they forget.
Mm-hmm.
Like, and we all do. Like, we take what we...
It's a defense mechanism.
Yes.
That's the way our brains work.
Well, and our brain remembers. Like, yeah, you look like this.
It's also trying to compartmentalize and forget stuff.
That too.
Yeah.
Yes, like traumatic experiences. And then this one was a really long post. But the gist of it was, for anyone struggling with post-operative depression and self-love, celebrate your small wins. And they went on to talk about one of theirs was... There were, again, very few responses, which I found so sad. But this person really summed it up. They said, true. With every physical change and enhancement, I care less. No one cares about these changes, so all that matters is how I feel about myself, which is incidentally the only thing that people do really care about and what makes one attractive and unique. Their energy, their attention to the world, and their way of dealing with life. In short, no one gives a flying bleep that out, Nils. If your nose
Can I say it? Flying bleep that out too, Nils.
Right? Is 3 millimeters thinner, but they will appreciate your kindness and positivity.
Right. And your ethos and your energy and your empowerment and your pumped upness.
Yes. And we see that. Like I say, one of the best parts of my job is that we get to interact with so many unique people that, you know, I'd never probably run across in normal life and or have the ability to communicate with them like we do. People are fascinating. And the ones that are the most fascinating are the ones who just have that thing that no amount of external anything could take from them or give to them. They have energy. They have, you know, vivaciousness in life.
Joie de vivre. That's what the French say. But there was a patient this week, a mom, really sweet, normal, nice, was nervous before surgery, came in and saw her. You were taking out the sutures and did a breast lift and augmentation on her. And just the smile on her face.
She's so happy.
So happy. And I was like, God, we have the best goddamn job. I mean, seriously, not many people get that experience.
That'd be the only place where you're taking sutures out of a person and they're smiling.
Exactly.
Weird.
It's so weird. I'm not gonna. We have a weird job. There's so many weird things, but just that feeling of positivity, you could feel it in the room. She was excited, and we get that over and over. And that is, even for us, is kind of infectious a little bit. So, I mean, sometimes I have to tamper down. Like they'll come back, what else can we do? I'm like, oh, that was so exciting. Let's do something else. But it can be really, really amazing for your life.
Mm-hmm. Yeah. I mean, today's clinic exemplified that in many ways. I mean, that patient that we saw who had surgery with us about a year ago and went on to lose an additional like 80 pounds. And looks like a completely different person.
I mean, that almost put me in tears. He's a young person.
All of us, I think, were about in tears, even him.
He struggled with weight. He had gynecomastia. We did a gynecomastia surgery, a pretty intensive one, pretty involved in the operating room, not in the office. So it was a rather extensive surgery. And then he went on to lose a crap load more weight, and he looks amazing. I mean, I felt like the most amount of pride. And it wasn't about anything I've done. It's just for him as a person, and that feeling. I mean, it's just so unique. I agree with what that really good doctor said on that video.
Who was that guy?
Which is me. How you doing? No, but I agree. And like, it's such a gift.
Yeah. Well, then
for us to experience that.
You take that and juxtapose it to the other patient we saw today, who was one of our trauma patients, who was thrown from a horse and had a broken jaw.
Right.
That I was literally having to, I say rip metal out of her mouth today, and I was having to. And, even through all that, she asked me to specifically say thank you to you at the end. You know, like, thank you so much, like, for you being there. I mean, like, it's just, these are people that we interact with their lives just in a little blip, like a drop in the bucket.
It is weird. Okay, number one, as Nils said, we are taking sutures out of people and they're happy, which is a weird dynamic.
Most of the time.
But like, if you consider their lives, we're like just two ships passing, we meet each other and then they go on. It is fun though, every now and then. Like, we just had a patient come back we did surgery on her in like 2018. We're doing another surgery on her, a different type of surgery. And it was so fun seeing her like 7 years later.
Oh yeah, I mean, we've seen that a number of times. And it's very cool.
Yeah.
All right, Dr. Martin, we're going to get your number 3.
Well, I had to throw this one in here. It doesn't need an explanation.
Okay. Everything you need to know about brachioplasty part 2. We had 2 questions and a comment. So we'll start with the first one. This was from Emmett Carlson 2739. This was the first plastic surgery I did in Malmö, Sweden, after I lost a lot of weight. The results from this kind of surgery are amazing. I don't have to hide my arms or myself in a hoodie anymore. It gives great freedom of my body expression now. Smiley face. Thanks to you two for the great information you give.
I love it, Emmett. I love it. These are the type of comments that just really keep me going, man.
Yes.
So thank you.
And the scar,
Yeah, who cares?
Exactly.
Yeah, and the fact that you don't have to wear hoodies anymore, that's my love language, man. Yeah. So this is great. I love it.
So this next one came from Aaron Enjuenhard.
Yep.
4015, because everyone has numbers. And I haven't actually gone back to listen to this episode, so I don't know.
Oh, no, I know this comment. So by the way, I rarely read comments. This is an absolute truth. And I just happened to go down, and he said, or this person said,
right, because you remember, Dr. Martin, not everyone is watching this, so let me read it.
Okay.
So this was the question.
Yeah.
Did he say dire wolf?
Yeah, I did. So I did say woof. I am from Kentucky.
What is a dire wolf?
No, but like it's a wolf with an L, but when you're from the South, you lose syllables in words and they just disappear somewhere.
So is a dire wolf a type of
dire wolf is an extinct wolf.
Giant wolf.
Oh, this was really the DNA thing you guys were talking about.
That was also in a Game of Thrones.
Yes, bringing back the dodo is what brought this up.
Yeah. And the Starks had dire wolves. Each of them had one. It was an amazingly rare animal in the show, and they're bringing it back. And I did say woof. There was no L. I said woof, like you're woofing.
Dire wolf.
Yeah.
So yes, Aaron, he did
say that.
Did you read that
comment?
Yeah, I did.
Yeah, okay.
I was going to say, visit our episodes on the toilet, the toilet.
The toilet?
The toilet.
He also says sconch. And I'm like, what is he talking about? He means sconce.
Sconce.
There's no H.
I love it.
It's scotch.
Sometimes I wonder if the way I say it is correct and the way everyone else says it is incorrect.
Well, a dire wolf could be like the baby. It'd be cute.
The wolf. Or that's what a dire wolf.
The dire wolf. Yeah. He's like a puppy. He's the puppy. Aw.
You know, it's very funny.
Nils, can you AI me a dire wolf?
There you go.
I'll hold one. They are so cute. Can we get them back?
Yeah.
Oh my goodness, our comments are the best, and I think Erin spelled that way I would say as a woman, E-R-I-N.
It was funny when I was picking that clip. I went back and read more comments, and it was like everyone from Kentucky was hitting us up. And this one lady was like, "I'm from Nicholasville." He's right; they do pronounce it "woof." It was just so funny. Yeah. We were way in the weeds of the internet, which is made me happy. And I do say "scotch."
Yes, you do.
Which I'm not really sure that even is phonetically correct. Have you read the word?
No, it's not. It's not in any way.
I'd say library instead of brary.
I mean, that's just a dyslexia thing.
No, it's not dyslexia. No, you have dyslexia, not me.
But I mean, when you say
Kentucky.
It, library is just like switching the letters around.
No. Sometimes you don't need syllables. You don't need letters. No. It just takes too much energy, you know? The further you condense it down, the less you have to move your mouth. That's the way I think people look at it.
There you go. All right. Well, we're going to take a quick break, and we'll be back for the ones and twos and the mashup.
Let's go. And we're back. If you're ready for old movie trivia, Dr. Martin, who does number 2 work for? Oh, yes. Can you play that? Or
you tell that turd who's boss.
Less than 10 seconds? Right here.
Who does number 2 work for?
Thank you.
All right. Without further ado, here's my number 2.
Who does number 2 work for?
Breast removal for breast cancer.
Oh, yeah.
A mastectomy.
So 5 years, yes.
10 years. Ooh, double nose.
And then no, yeah.
Of course, 20 and beyond, no.
I mean, this is my hope. I mean, talk about barbaric surgery.
Yeah, so I like this optimism.
Yeah, so mastectomies came about in the 50s and 60s.
Yeah, like we have cancer, let's just cut this whole organ off a body.
So they were very barbaric in the old days. They would take the muscle and skin and
bone,
everything, or sometimes bone, but
like
they were very aggressive. And now we have modified radical mastectomies and modified mastectomies. We have lumpectomies with sentinel node biopsies or sampling of the lymph nodes, radiation treatment. What I think is going to happen in the future for cancers in general is these super aggressive cancer treatments, like surgical treatments, and these super aggressive doses of radiation are going to go by the wayside with these novel medications. They're like chemotherapy that are affecting your immune system.
Yeah, the immunotherapy. I mean, that exists now and is really effective for some cancers.
Yeah, it's really good. So I think you're going to see that going to be more and more common. Yeah. And the data is coming out that we could start to be a little less aggressive with these breast cancers and do a lot more of these immunomodulating treatments. Melanoma is already there. Melanoma has changed in the past 10 to 15 years. The treatment of
even
it,
in the last 5
longevity,
years.
mortality rate has dropped because of these immunomodulating medications. So yeah, I think for sure by 20 years, you're not going to see a lot of mastectomies.
Well, and I think also this shows, the progression of our understanding of the progression of disease, where in, base level medicine, like this is the offending factor, just remove it. That doesn't always solve the problem. That doesn't always extend out or extend lifespan, which is interesting.
Well, I mean, most cancers, almost all cancers now, you remove it with margins, and then you check the regional area to see if the cancer had gone somewhere. So it would be a lymph node in most cases. You do that with all the GI cancers, with breast cancers, with head and neck cancer. So almost everything you're checking. And if you can't check the lymph nodes, you'll check a PET scan, something that sees where there's increased metabolism, and maybe they're looking at the spine or the brain. Maybe it's his, has a malignancy that has gone other places. But you're absolutely right. So the idea on this is that trying to surgically cut out something that is archaic, right? It's archaic in its basic nature, but it's what the data has shown to proven to be the most helpful.
Right. Well, because that was what was done.
Right. But I think in the next 20 years, you're going to see a switch.
Yeah. I hope so.
We're on the precipice right now.
Yeah.
I don't think surgery is going away. I think surgery is here for a long time to come, but I think you're going to see a whole change in this treatment protocols because Amy and I see it. It is devastating to watch people go through breast cancer treatment.
It's the worst.
It is.
It's awful.
It's awful. And you feel for these patients. I do breast reconstruction.
Like being a woman, like feeling like your breasts are a ticking time bomb.
Yeah, I know.
And that the solution to fix it right now is just awful. Like it sucks.
Right. But it's life-saving. So yeah.
It's life extending.
Yeah, exactly. So, I mean, that's what you have. But I do think that the future is bright for these kind of cancers for sure.
I hope that's the case for all cancers ultimately.
Yeah, I think, you get in, cancers are so weird. Like you want to group them all together, right? Like there's so many different types of breast cancers. There's invasive ductal, there's DCIS, there's lobular.
Don't you think like with AI though, that we'll have that ability to, as we start to be able to really nail down the offending genetic factors of some of these?
Oh, I am so happy I'm a surgeon. AI is going to take over so many people's jobs in medicine. I mean, I'm not even looking over there with you in production and editing, but it is going to absolutely revolutionize healthcare and especially cancer care, oncology, all this kind of stuff.
Anything where you need mass data.
Yeah.
And where there's just so really, truly, even things like breast cancer, we weren't really starting to treat this until 50, 60 years ago, right. Because we didn't know how to find it. We didn't know how to, these things are all relatively new. So, I am hopeful that the solution for some of these things might be better than other things.
Right.
Yeah, I don't know.
And people think, 20 years is not that long. That's pretty long in medicine. Things change really quickly.
It's pretty long in technology.
Yeah, in technology too. You think 20 years ago, so this is 2505.
We've been working
The iPhone
together.
Didn't even come out till 07. That's so nuts.
That's when Dr. Burr and I started working together.
Yes.
The year of the iPhone. He still had an Android phone back then.
Oh, I did. And I used to play the snake game on it. I remember that. And I had the keyboard that would flip out from it. It was awesome. I love that.
That episode was so good. And if you did not watch it, or you should, but we had these little paddles that I made that said yes on one side, no on the other. So I had Nils ask us the question and then we would hold up our paddle, yes or no. So that's how that started.
The future of plastic surgery.
Highly recommend listening to it. It was a great episode. And that was the very final question. And I was really hoping that it would become a deeper conversation. And it did, and then became even better and so good.
Yeah, that was a good choice. That phone, I found that phone because we were trying to look for baby pictures. Our kids are coming home and they want to see some baby pictures. And I found that phone, and I'll never forget that phone. It was a Droid phone. It would say Droid when you started it up. And I was like, that's the coolest thing ever.
I cut that. I didn't want to cut it out, but it was just made it a little too long. But because you took a big pause and you're like, I'd started and it would go Droid.
Yeah, he would sit in his office, which was like down the hall from me, and I would hear it. I'm like, stop turning your phone off and on.
All right, so my number 2, who does number 2 work for?
Work for you.
Work for you.
Mm-hmm. Yeah. Number 2.
My number 2, you could have had every one of my choices from the 200th episode, which Nils will show you right here and afterwards.
Well, they're all linked. All the episodes are linked, right?
So I just picked one of the 100 that I would have picked. And going back and watching it, I would like.
It's the best part is watching it.
Watching what you look like, Nils, and what you look like, Amy. I was like, if anyone stumbled upon our channel and just happened to hit that episode, they would be like, WTF.
Yeah. I was channeling my inner Audrey Hepburn.
Anyways.
Yeah. I was very Breakfast from Tiffany's. All right. Well, let's hear your number 2.
So now it's on to Amy. Here's the next one. They can sleep standing up like a horse.
That was Nils.
You're right. Producer Nils. And that was things we wish you knew before having our final class.
I was dying laughing when he said that. Like, that's one of my favorite moments of the podcast.
There's probably a lot of plastic surgery procedures that we do that if you slept standing up like a horse, you would be better off.
You'd be better,
Yes.
You know, I remember that.
Fat transfer for sure.
This clip made it into the mashup.
Oh, it did?
Yes.
Okay,
yeah. But yeah, it was because we often discussed with tons of different procedures, of course, recovery and sleeping. And it's just like Dr. Martin's always like, well, then how do you, and like, would this work and that? Because it seems to be just a science within itself that, people have to kind of figure out how they can get comfortable without doing certain things that could cause a lot of problems.
Which is why you have the sleep expert, Amy, the poop expert, Amy, the sex expert, Amy.
The pillow expert.
Yeah, the pillow expert,
Amy,
yes.
Yep.
Also great for sex. Those pillows.
Yep. All right.
Truth. I answer this question on a daily basis. People ask me when they can have sex or how, because I'll say yes and they'll be like, how? I'm like,
so he cut it out there because like it goes on and I just like I watched it this morning and I'm like TMI, and then you're like, no, it's not TMI. You just kept on talking about it, which was so good. That's what I love about you.
Yeah. Well, the 200th episode is incredible.
Yeah.
And my number 1 clip is from the 200th episode.
Oh, yes.
So I asked Nils before you got into the room if he knew why I picked it, and he doesn't. And I'm wondering if you're going to pick up on why I chose it.
I'm pretty good with things like this. I usually pick up.
Okay. We'll see if maybe Nils hearing it again, knowing that there's something he should be listening for. We'll hear it in this one. Here we go. Nils, should I wrap it up?
One last thing. I just want to thank Sarah.
Yes.
Oh, yeah.
Huge shout out to Sarah. We would not have slides without her.
Yeah. We wouldn't have really much without her. Now, Nils is amazingly talented, but Sarah, I mean, is like behind the scenes amazing.
I have to bounce a lot of stuff out. Does this make sense? Does this work? And of course, her design and everything. She's always super busy. She always fits it in. She always, she always gets it. So, thanks to her. And I think that wraps up 200. So Amy, back to you.
It is very hard to spar with Sarah because she is a lefty. It messes with my dyslexia a lot. I always was worried that I was,
She is so sweet on the outside, but she has a
she
tough
packs
inner
a
core.
mean punch. Yeah, I always told her, like, if you hit me, it's my fault because I was blocking wrong.
She's kind of like those animals, like they're real fuzzy and cute looking until you get too close to them, and then they.
Oh, it's you know what?
That's Sarah.
She's like a hedgehog.
Yes.
Like they look so cute
like
and cuddly.
You want to snuggle with
like
it, like
you
a
want to
little
pick
baby
them up.
raccoon.
Yeah.
Like, oh, Sarah, you're so wonderful.
Well, they are until they aren't.
Now Sarah's amazing.
She's
kind of a honey badger.
Yeah, honey badger.
Honey. See, I was thinking more hedgehog.
Yeah.
Cute. Yeah, really cute. All right. Well, we thank you all so much for listening. See you all here next time.
See you later. See you episode 300, Amy. Next time.
Well, now I know why nobody caught it because Nils cut it out. So I say that I'm talking about what episodes are going to be coming up next. Yeah. And I say, listeners from questions.
Oh, is that what you said?
On our next episode of Listeners from Questions.
Okay. Yes. No, I didn't think we'd need the whole ending.
That's what we needed. I was like, I was walking and because I listen more than I watch. Like I'll watch them when they first come out, but then I was kind of like re-listen to them. And I was just walking along and I'm like, oh, that's such a good episode. And I'm listening to all the things like, man, Sarah really is amazing. And next episode, we're going to have listeners from questions.
Yeah.
And I talked about being dyslexic with Sarah.
I never even got it.
I like that we referred to Sarah as a hedgehog. I forgot about that part.
I can put it back in.
No, it's almost better if you leave it out. I mean, like it was so funny because I was talking about being dyslexic with Sarah's lefty punching, and I'm like, I said listeners from questions.
I didn't never caught it. I probably watched it 6 times in all the editing and everything. I never heard you say that.
Listeners from questions.
It could be that she does that all the time.
It could be. And you're just like, this is just how Amy, this is just how Amy talks.
She talks like Yoda. She puts predicate before the noun or whatever.
Listeners from questions.
Yeah. All right.
So that was my number
good.
one.
That was good.
Mostly my number one because Sarah really is
do
incredible.
love
And we
Sarah.
could not do it without Sarah.
Love Sarah.
Yeah. And Nils. Yeah.
Yeah, I love Nils.
All right. Dr. Martin, your number one better be better than mine.
Well,
better
I don't know.
be better.
Let's go. Let's try
hear
it out.
Dr. Martin, it is time for one of our favorite episodes of the
Favorite
year.
episode.
The Cowboys bag
And I got my lunch pail. You have to watch on YouTube.
is on the table
Yes.
to watch us on YouTube, and this one you definitely will want to watch. So
This
if you're
literally is what I carry my lunch in.
So if you are listening to this episode, I highly recommend watching it because we do have some show and tell. This is
Yeah.
an interactive episode. This is
I
stuff
think
we're
was-
into.
I think, how many times have we done this?
This is our 7th time.
I think the 5th time you brought in a Swedish penis pump, didn't you?
Actually, that was last year.
The 6th
Yep,
time.
and that was
Nils and I felt that was very funny.
my coffee press.
Okay.
So
The Aero Press, actually.
yep, in this episode we call it stuff we're into, and we each have our bag with things we're into, and we're going to reach into the bag. So this is Nils, the moment where if it's not copyrighted, you can put in the clip from Flash Gordon where they are reaching into the tree stump that has the like killer scorpion inside of it. Remember that?
Man,
Reach it
forgot
in,
about that one.
see if it stings you. So that's what this is. So I have given Dr. Martin. Usually I have stuff to give you guys, but I don't know that you'll want any of these things. So and they are all clean. So I'm saying that right now. I've told you that once. I'm telling you again. These things are all clean.
It's making me concerned.
Okay. I just don't want you to hesitate when you
Okay.
reach into the bag.
That's right. I'm not going to. Okay.
All right. So we're going to Rochambeau it to see who goes first, as we
Okay.
always do. Are
Yes.
you ready?
Ready?
All right.
1, 2, 3, throw, right?
Yes.
Okay.
Okay.
1, 2, 3, throw. Okay. You go first, right?
No, you go first.
Oh, I go first.
Yeah.
Okay.
That's the first time,
So-
Nils. I think that's the first time ever that we haven't picked the same one on the
Yeah.
first
I
time.
think you're right.
Yeah. Scissors, statistically always wins. Okay.
All right. So no, that means
That
that means I go into your bag first.
Oh, that's right.
Yeah. Yep. It's still the because we did Rochambeau on our 200th episode,
I know.
which
I
came
was
out
giving
after
some
this.
Easter eggs. That was what I said about
Yeah.
the Rochambeau beforehand. But statistically speaking, if you ask ChatGPT, scissors always wins. 100%.
100%.
I like that for so many different reasons. Probably the main reason is you pick a Flash Gordon episode from 1979 to exemplify some point, and somehow Nils found it.
Yeah. Found it and watched it. And
Yeah.
it's a really awesome clip. And we were
Yeah.
just talking about Timothy Dalton playing the other prince.
Also, things we're into, Nils will link it right here or show you right here. So another reason I picked that is that, do you remember we don't have to talk about, but one of the things that was in your bag
Yeah. And I emphasized a number of times that everything in my bag was clean.
was clean. And I missed that when I watched the episode before. So go back and watch this episode. You can see one of the things that Amy presented.
Yeah.
that
And like
day.
I kept saying it because I didn't want you to drop it. Because, everything in the bag is clean.
Don't have to talk about it.
Yep.
I've gone through it. I feel like I've survived it. And
Yep.
I think we've moved on from that episode and that experience.
Everything was clean.
Oh, I love it. I love it.
All right. Well, Dr. Martin, those were amazing clips. There were so many. It was hard to pick this year.
Very hard to pick.
Like it always is. But man, this year I felt like, and as you noted the same thing, we were chatting about it, there were just so many good educational clips.
Oh, yeah. Very,
know,
very proud of the material we're presenting, really proud of what Nils has allowed us to bring to the table in terms of engaging content that people can listen to. Because when I re-listen to it, I'm like, oh, this is really good for a patient. This will help someone. And that's why us three do this. It's a passion project of helping other people, giving back our knowledge base and Nils' skill set. So this year of all the things I watched, it was really hard to pick something because they were all really good and educational. How many times can I show Amy saying words in reverse?
Backwards. I tried.
At some point, the entertainment value of that goes down. So but I don't know. Maybe I'm maturing. Maybe I'm just really finding the meaning of what we're doing here is what we're doing here.
Yeah.
Yeah.
All right. Well, now the moment has arrived. It is time for the Producer Nils mashup from 2025. If you didn't watch my top, it was the one we released at the beginning of December. So the Happy Holidays episode, I link all the other mashups in that video. So if you want to watch all the mashups for the previous 5 years, go watch that one also. But without further ado, here is the mashup. I'm so excited. I'm nervous excited. Here we go. Okay. Welcome, everyone. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. I did not say welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. There we go. That's the way to start it. My very inquisitive co-host, Dr. Martin, how you doing?
I'm doing pretty good.
I mean, it's 2025.
I didn't know what podcast we were doing for a while there.
Who knew? Dr. Martin, do you know what day today is?
I have no idea. What day is this?
Today is Wednesday. But what else is significant about today?
Is it my birthday?
It is January 1st, 2020.
5.
Can we get like the number 5 from Sesame Street?
Yeah, totally.
Yes. 1, 2,
Again,
3,
showing
4,
our
5,
ages.
6, 7, 8, 9,
Yeah.
10, 11, 12.
I feel like that was Electric
5.
Company, but that's probably Sesame Street.
I think that was Electric Company,
Yeah.
actually. I think you're right. Yes.
My research was extensive this episode. I probably spent at least 40 or 50 hours going through everything. It wasn't an hour.
You, Ron Burgundy?
Yeah.
I don't believe you.
Yeah, exactly. I don't believe you. And one of the things that came out just in November of 2024 in Nature Microbiology was this study. Coffee consumption is associated with intestinal Acinetobacter abundance and prevalence across multiple cohorts.
Is that good or bad? Just tell me right now.
It's good.
Oh, thank God.
So this is a
Because
specific...
I love coffee. I know. I was like, if coffee's bad, Nils, we're screwed.
Oh my gosh, what was that game we'd play when we were kids where like you were either a deer, a food source, or water, right? And you'd run across and like basically you're depleting your resources.
Where did you grow up? Game of Thrones? What are you talking
That
about?
sounds like a Colorado Mountains
In
game.
the woods. Yeah, yes, it was.
You get a bow. I get a sword.
Yeah, we're going to run across the field and kill each other.
And
Yeah.
then
Tend to
we'll
be
just figure out
forest
who lives.
Yeah. So we're going to take a quick break and then we're going to come back with a few more isolated questions.
I'm going to go on Weird Reddit during the break.
Oh my goodness, please don't. Do that from your own computer.
I'm going to do it on your phone. I'm going to mess up your algorithm.
My algorithm is going to have some weird stuff on it.
The idea of plastic surgery, the way we do it, which is like, assumably, this is the way most plastic surgeons do it.
Assumably.
Nice. There's one.
Is this? Okay. Is that a real word? Or?
Assumably.
I don't know.
It's going in our dictionary.
Yes.
Okay, good.
It is going
The
up there
Martin Medical Dictionary.
with volume S.
Yeah, assumably. Yes. Yeah, volume
Assumably.
S. And was that was that an ALCL episode?
It was. We had blessed implant controversies.
blessed breast.
Blessed implants.
Yes.
Those blessed implants. So this was from Samantha Wood Hull, 5372. People, why does everybody have to put numbers in their username? Like, I don't know why you do this to me.
This is when I wish
Yeah.
they didn't have copyrights. We could just play Next Episode by Dr. Dre.
You could sing it.
Yeah. Probably not gonna do that. We'd probably get flagged for that too.
No, you could sing stuff.
My voice is too good. Yeah.
That's right. You don't want to. I mean, seriously, putting that out there, like, yeah, nobody gets that
Sounds
for
just
free.
like him.
Yes.
Do.
Yes. Here, let me hover a gummy
There you go.
cluster.
Pink.
Dink.
And he brought that home, and I was like, "What is this devil's food?"
It's because it's that chewy, crunchy
Exactly,
combo.
yeah.
It is scientifically proven for you to get addicted after
Yes.
one bite. It's like the heroin of candy.
It is.
Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and my jester co-host, Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. It's April Fool's Day, Dr. Martin. I hate
I know.
all of the April Fool's Day things that people put up.
I know. I was thinking to myself, what can I say? I'm just gonna quit the podcast on this feed, and then you're gonna be like, "No, don't quit," and I'm gonna be like, "April Fools," and it never works.
No. Judy R.A. Fat. I doubt that, Judy.
Yeah, you're not fat.
Yeah.
You're not fat.
But my grandma used to say, "You's not fat, you's fluffy."
I hate to tell you, I think her last name is Rafat.
Judy Rafat.
Yeah.
Well, I'm sorry I called you Judy R.A. Fat.
But I mean, this is a plastic surgery.
Judy Rafat?
Yeah.
Yep. Sorry about that, Judy. All right, let's just move on from that. April Fools.
April Fools.
Cue the bunnies.
Yes.
Cue the eggs. Or am I the only one who has always found that like bizarrely odd to make children hunt for eggs? It seems very like phallic.
Well, when
in
you
a way.
yeah, well, that's fine. But when you have young kids, anything to get them out of your hands and away from you. If you do anesthesia,
You do. I was gonna say.
why does that always make
If
it
you
so
do,
funny?
where's the doo-doo bird?
Yeah, I don't
it's
know.
a bird. Let's pop up a doo-doo.
Right.
If you do. Dr. Martin, there are some rules to this, and it's that you can't interrupt Nils because he has a job to do.
Okay, but
You've already interrupted me.
can I win?
There is no winner.
I'm not sure I like this game.
All right. So our next question. Our next question. I became Southern.
I knew that Kentucky would come out.
The
I knew it.
question.
And I didn't get the nice, soft-handed lady. I got the brutal man who treated my feet like he was angry at the world. I didn't want him to be angry at my feet. I wanted soft, nice.
We asked what people thought the future of plastic surgery was going to be, and she said maybe a liposuction machine that makes it impossible for a doctor to make a mistake and also tighten
Please,
skin.
I am a machine, Monica. I am a machine.
What if it's an AR like system that's like the game Operation where if you lipo outside it buzzes you, so it like kind of keeps you in the line?
Like negative feedback.
That's
loop.
exactly what it is. How did you know?
There's a robot with a barb right behind you. Like every time you make a mistake, it just zaps you.
Nils is speaking from personal experience. You can go on Reddit and get a lot of myths.
You can get a lot of what is
A lot
it?
of interesting
Pedantic
comments.
Reddit is what we like.
Oh, yeah.
Yes, remember you said weird Reddit.
Yeah, we
You
don't
kept
want
saying
weird
No,
Reddit.
no. Pedantic, yes.
We clarified.
Yes.
Dr. Martin should not go in weird Reddit.
No, because Reddit can get weird. But
I don't think I've technically ever been on weird Reddit. I mean, so I'm gonna avoid it.
Yeah, Amy had to tell you what it was.
Yeah.
Tell you to
there's-
stay away from it.
Yeah, stay away from that, Dr. Martin.
no, Justin Harris has maybe the biggest forearms on a person I've ever seen in real life. Like
Popeye is the biggest.
they are bigger than Popeyes.
Yeah.
Like impressive forearms.
Okay.
Yeah. All
But
right.
can he control a fire-abating plane with his vagina?
No, because he doesn't have one. But I can.
Yeah. I still might blow up my face with Retin-A. I'm just not going to tell you.
Step right out in the sun
4 count
after
breath.
that.
There's going to be
Breathe in for 4 counts.
it's going to be a
hold
podcast
it,
with me with a
Skipping the
glowing
sunscreen.
red face,
Breathe out.
and she's going to be like, "What the hell did you do
We'll
to your
know.
face?"
We'll
Dr.
know.
Martin will use sunscreen.
Yeah.
What do you say during surgery?
If you suck it up, we'll suck it out.
No.
This doesn't hurt me.
Ding, ding, ding.
Here. That's my
Yeah.
running joke.
This doesn't
Don't
hurt
worry,
me.
don't worry. This doesn't hurt me.
Yeah. Like, how bad is it? Like, not bad. And he'll say to people when they're leaving, like, so how bad was that? Like a 2? And the person says it yes then because they're numb.
I'm putting it into their brain before
Yeah.
the pain comes.
Yeah. We call it the lower trunk lift,
Lower trunk and butt lift
which is also the trunk.
with a little bit of the thighs.
You gotta lift that trunk.
You got it. I think it's like that piece. My lovely lady.
What you gonna do with all that junk?
Junk in the trunk.
Yep. Think about things you use on a daily basis and move them as close to weight height as possible, or weight level. Sorry, not weight height. Waist level as possible. Weight height. That's what I said. I said
Yeah.
weight height. Waist level.
But I thought we'd do this without drains, Amy. Drainless surgery.
You're gonna have drains with this surgery. You will have
I am
drains.
flying into the ore on my unicorn
Yeah.
without drains.
You will have drains. And this comment was from Lydia, and she said, "One leg is big than the other" from poetry.
Is that like a haiku? I don't understand what
I
she's
don't
saying
know,
there.
Lydia, but I liked this comment up. I'm going to put it up there. I don't know what it means. We weren't talking about the legs, but I'm still putting it up there.
I like that.
Yeah. Ooh, can you make Dr. Martin the Headless Horseman?
So do you want him without a head or the pumpkin head? Which one is it?
I'll take the pumpkin.
He was holding the. He was always holding.
holding
the
his
pumpkin.
Here we go.
Yeah.
Here we go.
You're holding your own head? Well, that's even worse. Not liking that at all.
What I do
we
is I
also
go
lack.
and I think, what would Nils be doing right now? Viking Nils.
He'd be like hollowing
That's
out
all
a,
Nils
a
does. He
tree,
just does curls all day long.
Yeah.
Sarah's like, come over here and work. He's like, I'm curling
curling a log.
logs with my braided hair.
Yeah.
I'm a very knowledgeable physician, but I'm sitting there.
Wait, you wanted to come into the office the day
Does
after.
that feel great?
And I was like, absolutely not.
Yeah. And then by day 2, it felt like someone had dropped a small missile into my groin and like ignited it. I'm going to say a few superlatives of how special I do it, and I'm a unicorn in the woods. No, I'm not going to do
I
that.
mean, if you're gonna be, if you were a unicorn, you really want to hide out in the woods?
I don't know. I feel like unicorns stay in the woods. What if they did? I mean, you don't see unicorns walking down the middle of an urban street.
But you should. I mean, if I was a unicorn, that's where I'd be strutting, right? Yeah. You should definitely be watching this. If you're not watching it, go to YouTube because I have a crown. It is our 200th episode.
Let's go. Let's go.
Cue the fireworks.
Yes.
And I'm going to turn it over to our amazing co-host Nils, Viking Nils,
Yeah.
gorgeous Nils.
Well, this is my formal wear. This is what I.
This is what he wears to work every day.
Yes.
You have
This
to
is
go
how
on
he
YouTube to
always
see it.
looks. Yeah.
You guys usually see me in my own scrubs, but today I'm in my regular clothes.
Well, I feel the same that Amy feels. I feel like this stuff is all right in front of me and it all is meaningful. And I think the main reason that is because I work with amazing people, Nils, Sarah, and Amy. And it makes it so joyous. And then the second part of it, we get to interact with listeners who are actually going through their own journey. And it makes us feel like we're adding to the ether, to the world, like adding to people's experiences, educating them, empowering them, and doing the things we can do to impart our knowledge over, and also hopefully make it engaging and fun.
And speaking of, thank you to all of our listeners. That's the comments and questions that we get are such a big deal because it means that people are listening and inquiring and everything else.
And just know when you send your question, a Viking will receive it. Actually, it's Amy. Now that she knows our telephone number, we should have put that as one of our favorite episodes.
Me saying my bank account number for the phone number.
Yeah.
Yeah. So
I'd take care of you.
think it through, Karen. I would take care of you.
Good. Nice.
Yeah. Yep.
Okay, let's pack that out. Let's shake on it.
Deal.
Okay, deal. That was awesome. Thank you, Nils.
I'd take care of Nils after surgery too.
Yeah. Oh, thanks. I might need it someday with the way health insurance is going.
I didn't say I'd pay for your surgery. I said I'd help you after
I don't
surgery.
think I could go to a hospital anytime without.
We're gonna have a Beauty
being
and the
bankrupt.
Surgeon where Amy and I are gonna take care of everyone associated with the show.
Yep, like we got you.
Yeah.
That's good. Yes, but yeah, great. You saw not a lot of stumbles by you this year. So
Yeah.
It's on my
She's getting
game.
better.
yeah.
On year 9, we're really getting better.
Finally figuring it out. Oh,
well.
as I have a big yawn. Oh, 2026 is exhausting
I know,
already.
I know.
Oh.
Well, I loved it. As usual, Nils knocks it out of the park. Maggles and media, if you need anything like this, he's super talented. But the one thing that I did like about this in general is that we have all their educational stuff in there, which is really good, but there's so many things in there. You can see the joy that we have between each other. It's just pretty obvious in this video. And I know this is not going to get the most views, but if you want to define what we do, it's this video. That's how fun this is when we do this podcast. Every now and then I'll get people ask me, they're like, oh, Dr. Martin, why do you do that podcast or whatever, that kind of thing. And I'm like, because I enjoy it. And they're like, what do you mean you enjoy it? I'm like, well, I do. I don't know how else to say it. So it's like being in a room with friends and laughing and enjoying ourselves.
And a Viking.
And he's really a Viking.
Yeah. I'm actually kind of surprised that me throwing my own crown off my head.
The weird thing is to see him walking through Whole Foods and people staring at him. He doesn't care. He wears that.
Just his fur. Yeah.
All right.
Well, Dr. Martin, as I mentioned in the intro, I like even years, but I'm going to keep any thoughts that I have about it to myself.
Right.
But I am going to say this, and I'm going to say it on our next episode too, that I heard this really awesome quote this week, or this saying, because people always say like, well, you only live once, right?
Right.
And this person said, no, you live every day. You only die once.
Love it.
So let's do 2026 right.
One more year. That's 20 years in practice too. So that's a milestone for me too.
Yeah.
So we're definitely got to celebrate that.
Means you're going to, oh my gosh, in 2020, you have to redo your boards again.
What are we talking about?
Already not looking for
Yeah, I'm retiring before that. All right.
All right. Well, until next time, we would love it if you would leave us a comment. Tell us what your favorite moment of 2025. See, I'm so used to saying 2026 now, what 2025 was. If you have any comments, questions, leave those in the comment section below. You can also leave me a voicemail or send me a text at 303-630-9038, because we do occasionally do episodes of questioners from listeners. Questions from listeners. Yeah, and we will see you all here next time.
See you later. You were such a struggle.
I was like in my head, I'm like, don't say it backwards. So instead I said questioners.